Hello, my name is Penda Boma. I am a student of Nightingale College. Today I'll be demonstrating insertion of a Foley catheter on a female patient. For this procedure, I have my dummy patient covered. I have some washcloth, gloves, hand hygiene, and Foley catheter kit. And get in the patient's room, knock, knock, knock. Patients allow me access. I get in, close the door behind me. Before coming in the patient's room, I perform hand hygiene. I will go ahead and perform hand hygiene in front of the patient to make them comfortable. I will ask for the patient's name and date of birth using the two-step identifiers. The patient tells me their name. I check on the patient's wristband. It matches the patient. I will tell the patient that per doctor's order, the doctor wants me to perform this procedure. It's not going to take more than 5 to 10 minutes. Patient says, okay. At this time, I'm going to position the bed at a good working space. I will reposition my patient into a dorsal, comfortable position where we can have a good working space, making sure that the patient's base is on my dominant hand. At this time, I will go ahead and put on my gloves. So I have my bed in a good working position. I have my patient in a good dorsal recumbent position. So at this time, I am going to go ahead and ask my patient if it's okay if I expose them. The patient gives me access and I go ahead and expose my patient. So now that my patient is exposed, I have to make sure that I have a waterproof under her so that the bed does not get wet. My patient has granted me access. I'm going to go ahead and start cleaning. As I'm cleaning, I'm observing the patient, making sure that there is no drainage, no discomfort, nothing uncomfortable. I get my first washcloth using a clean water and soap solution. Put my hand right at the top of the patient. I'm going to be cleaning from the farthest to me to the closest to me, top to bottom. Then another side, clean, top to bottom, closest to me. And now use this one in the middle, top to bottom. I'm going to toss this on. Got my second one. This is for rinsing. Same thing, farthest labia, top to bottom. Switch side, closest labia, top to bottom. Switch side, middle labia, top to bottom. Now that is done, I will get the last cloth and I will clean. I will pat down for drying. Farthest labia, top to bottom. Closest labia, top to bottom. And the middle, top to bottom. Okay. At this time, I'm going to go ahead and take off my gloves. Perform hand hygiene. And I will check my Foley catheter kit. Take it off. Put this in the trash. I will be opening this from the farthest to me, the side, and the bottom. At this time, I'm going to get my sterile gloves. Open up my sterile gloves. Make sure it's the right size. Okay. This is my sterile gloves. I'm going to be maintaining the 1-inch border. I have on no jewelry and I have on no watch. Maintaining a 1-inch border to maintain sterility. Okay, now I have access to my sterile gloves. I will start with my non-dominant hand, pinch at the cuff, work my way in. Maintaining that cuff as I'm working my way in. Maintaining that cuff. Making sure I don't break sterility. My sterile glove is on, so I'll go ahead and use my 2 fingers to grab my dominant one. Making sure that that one does not move too much. Same thing. Work my way in, maintaining sterility. My thumb is out. Maintaining that curve. Now that I have it on, I can fix it since it is sterile. Make sure it is well fitted. Okay, my sterile glove is on. I'm going to leave this here. I'm going to proceed to my kit. At this time, I'm going to grab my blue drape. Move this to the side so I have a good working position. Grab my blue drape. Shiny side down. I will ask my patient to lift their hip up so I don't touch them. Okay, now I'm going to grab the fenestrated dressing and put that over my patient. And now I have access to my patient. I will take off this kit, set up a swab. Okay, my swab is ready to be used. I'll grab the loop, pour the loop in there. Now I'm going to grab my catheter. I'm going to take off this plastic and insert that in the loop. This time I'm going to set up my syringe. Okay, my syringe is set up. Now I'm going to start my cleaning. With the first swab, I'm going to clean the farthest labia, top to bottom. Put that in the trash. Second swab. Closest labia, top to bottom. My third swab ran away, but I found it in the middle, top to bottom. Okay, put this in the trash. At this time, I'm going to go ahead and grab my catheter. I will inform the patient that this might be a little bit uncomfortable, so they should bear with me. I have to make sure I can see the urinary meatus. I see I have to insert it 3 to 4 inches in until I see urine. So I'm going to go ahead and do that. I will tell my patient it can be very uncomfortable. They should bear with me, but it's not going to last too long. So I go ahead and insert that in. Okay, right there. That's about 2 to 3 inches. I'm going to go ahead and blow up the balloon. Okay. Before I blow up the balloon, I checked with a little top to make sure that it is firm in once I saw the urine. So I'm going to take my kit at this time, my catheter kit. I'm going to secure this beautification to the patient, making sure that it is stable and it does not move. For my catheter, I would secure it by the patient's bed so that it is stable and it does not move. Then I'm going to observe the urine if it's cloudy, if it's consistent, and if it's flowing at a normal rate. When that is done, I will take off the dressing for my patient. I'll clean them in the trash. Then I will thank them for letting me perform this procedure. I will take off my gloves. Perform hand hygiene. Reposition my patient in a comfortable position. Cover my patient up. Hand them the call light and tell them that I'm going to document the procedure in their chart. If they have any concern, they can call us through the call light. Thank you.